My name is Dr. Arshad Iqbal, Arshad Ultrasound Clinic, Salim Arcade, Bulakio, Model Town, Lahore. I want to discuss about infertility and the treatment for infertility. There are many causes for infertility, and the diagnosis for infertility can be done by ultrasound. We have to see by ultrasound the uterus. There are different type of uterus: anteverted, retroverted, didelphus, biseptate, monocular, and some are hypoplastic. Size of the uterus is very small, less than 3 centimeter, 30 millimeter. Status of the endometrium must be checked. If the endometrium is thickened, maybe there are retained product of conception in it. And both ovaries must be checked. Usually the cause of infertility is polycystic ovaries. Pearl ring appearance of the follicles are seen in both ovaries, by which dominant follicle is not formed and the patient cannot conceive. Uterine malformation is a very important cause. Ovarian status by ultrasound to estimate is very important. Now to see the fallopian tubes. If they are dilated, hydrosalpinx, they are easily diagnosed by ultrasound. And to see the patency of the ultrasound, we will see by hysterosonosalpingography. We will, on real-time ultrasound, we will see the spill out of the fluid in the cul-de-sac. We have to rule out other causes also. Fluid in the cul-de-sac are endometriosis, endometrioma, large ovarian cyst, hemorrhagic cysts, and we have to see the cervix also, cervical stenosis, and Bartholin's gland, cervical polyp, cervical cancer. By all these things should be ruled out by ultrasound. First, this ultrasound must be done on the 5th day of the cycle, and second ultrasound is done on the 14th day of the menstrual cycle. That is called follicle tracking ultrasound, in which we will see the dominant follicle. The size of the normal dominant follicle is 18 millimeter to 25 millimeter. One dominant follicle is formed every month. Now for treatment of the infertility depends on the cause. If there is polycystic ovaries, you will give clomiphene citrate or injection menotropin, gonadotropin to ripe the follicles. If there is large hemorrhagic ovarian cyst, that must be drained. that must be resolved, and if there are other causes, then that must be treated accordingly. IUI can be done, and for the husband, sperm examination is very important. Azoospermia is usually the frequent cause in which TC is the procedure to treat such cases, but very difficult to treat. Otherwise, all other cases in which there is no azoospermia, no problem to treat such cases. And other diseases, hepatitis C, hepatitis B, must be ruled out. Ultrasound of the husband should also be made. Echocardiography of the husband should also be done to see the blood pressure and other causes. Patient can be cured very easily within 6 months. The patient can conceive and follicle tracking ultrasound monitoring is very important by giving clomiphene citrate and injection minotropin and gonadotropin. Thanks.